it is such an honor to be presenting at this summit alongside so many professionals who I learned from and I really, really look up to. And it's also interesting. I'm glad I'm presenting this evaluation piece towards the end because I had the chance to listen to all of your presentations. And, I think there are definitely some similar threads of things that we're suggesting. So I'll sum that up towards the end of mine. But we'll spend the next hour or so talking about program evaluation of MDTs. So here's what I'll cover. I have to say, I practiced this presentation with a friend of mine who's retired from our field, and she said I should explain this picture. It might be a little alarming to some people, but so I just want to let you know what I was thinking of when I chose this. And it's that I'd like to give all of you kind of a big picture view of the national scope of MDTs and some things that I have seen based on my travels. And that is that MDTs, I believe, are complex systems. So I'll be talking a little bit about that and explaining what those are, as well as the implications for research. And then I'll be going over, it's in broad strokes, what traditional evaluation is. I think it's really important, and there's some great things that we have found. However, given that MDTs are complex systems, developmental evaluation is a new and innovative set of approaches that I think could be really useful for folks in the field. So then I'll spend some time talking about that. And don't worry, I'm not going to leave you untethered, floating in an infinite vacuum like that astronaut. We'll bring you back to reality and talk about some specific strategies that you can start applying in your team. And actually, a lot of those strategies you're probably already doing. It's just a matter of being aware and systematizing them. And they actually, a lot of them align with some of the suggestions around incorporating person-centered and trauma-informed approaches. So it's nice to see that overlap. Okay, but first, just a moment. Andy mentioned some of this, and I thought would be important to point out my vantage point and how I've come up with my perspective on MDTs, because it is just that. This is my perspective, but I have probably somewhat of a unique set of observations and interactions with MDTs I've been able to make versus a coordinator and as a researcher. And as a researcher, I got to observe so many team meetings. I've listened in on probably thousands of MDT discussions. I spent years with the LA County Forensic Center when I was doing my doctoral work. And I also got to visit forensic centers across California. There were 4 total, actually, that we visited. And then I did interviews with them later, which was really interesting. 5 years later, called them up and said, hey, how's it going? What happened? And got to learn from what had happened to them over the course of that time. I've participated in a number of national surveys. One was a 3-part national survey when I was doing my PhD work, where we're just learning about the structure and what are MDTs, what do the members think, what do they do, how do they consider success? And then of those teams, we drew some site visits. We did 4 site visits total. And then in my consultation work, I've had the opportunity to evaluate some offshoot programs. There's a service advocate program in LA I got to evaluate, and I helped New York Lifespan with some of theirs. I've provided technical assistance one-on-one, and I've been evaluating the MDT Technical Assistance Center. And something else I've been doing recently is evaluating the coalition, Lifespan's coalition Technical Assistance Center. And it's just so interesting, being able to see all of these teams from a high perspective. I mean, the 1,000-foot view, and how you are all connected, and the similarities across all of you. So I've come up with this premise. Program evaluation strategies and methods are based on premises. And usually we actually don't discuss these because they're things that we just assume to be true. But essentially, premises is, just that. What do you assume to be true about the program? And it is actually really important to consider what your premises are, because this will help guide what methods and approaches are most appropriate and useful for your team. So I'm going to introduce you to this premise, and then we'll talk about some implications. So complex systems have been studied across many different disciplines, and there's a body of peer-reviewed research in other fields like computing and logistical systems, medical interventions, organizational design, and also efforts to address extreme poverty in developing countries. So this is just to name a few, but the idea of complexity and its application to evaluation is something that has been going on for about, I want to say 15 years or so, maybe more. And a significant part of this research has been defining the characteristics of complex systems so we can determine whether or not what we're looking at is indeed a complex system. So there's a few that are commonly mentioned which apply to MDTs. And the first is that complex systems have multiple perspectives. What this means is that there are a variety of viewpoints among the people within the system. And this is the very reason we create MDTs, to access different professional views of the problem and also potential solutions all in one sitting. And from the presentations we heard yesterday on person-centered and trauma-informed approaches in MDT, we also know that there are additional perspectives that maybe we don't always have the chance to hear in these discussions at our meetings. What's important to think about is that because there are multiple perspectives, there's a variety of perceptions of how the team works. There's different opinions of what it should do and what success does and should look like. Some views might be similar and some might be in opposition from one another. Another characteristic is nonlinearity. This means that the activities in development can be a bit unpredictable. I don't know about you, but I think it's fairly common in an MDT that you will lay out some plans, whether it's in a home visit or in a grant you're implementing, and then all sorts of unexpected things happen and you have to make some changes in process. And I think this nonlinearity looks like a lot of different things in teams. It can be gradual. Team members get replaced over time. Every time there's a replacement, you have to adjust. Maybe there's a new personality dynamic that's brought in, a new way of working that's introduced. Teams that have been around a really long time might see a replacement of all of their members and might be a completely different dynamic. And then nonlinearity can also be really dramatic. I've seen several MDTs that experienced a major disruption, such as a loss of grant funding, or a team that had to move from one sponsorship agency to another. For example, they were an APS MDT and then they became a DA MDT. And in each of these incidents, there was a loss of momentum and some frustration, maybe even a halt in operations of the team. But after some time, the team came back together and they made changes based on what they had learned. And this is a form of adaptation. Adaptation is when a system makes changes in its activities or structure to ensure survival in response to shifts in the external environment. This concept is closely related to nonlinearity. MDT adaptations occur when, for example, maybe a member organization undergoes a policy change, or perhaps there are changes in local politics and the team needs to respond either by adjusting their operations or maybe even their overall priorities. I remember one team that was getting a lot of self-neglect cases and observed that law enforcement and the prosecutor had little to contribute and they were starting to get disengaged. So this is an issue because these two disciplines were needed in other cases of abuse. And so what the team did is they adapted by creating two MDTs, one for self-neglect, where they could bring in professionals who were really only needed in self-neglect cases. And then another team met to discuss cases where there was abuse, where they could support and collaborate closely with law enforcement and the DA. Another form of adaptation might be to maintain relevance or take opportunities for growth. For example, a team might decide to apply for funding, and maybe the funding requires they include certain additions to the team, certain pieces of operations, so they adapt in that way. On the other hand, a team that loses funding might adapt by trimming down their activities so that they can continue running. Okay, emergence is similar to adaptation in that there's a change, but the difference is that emergence is a change that isn't necessarily based on a need to survive in the environment. Um, the cause of the change is more complex. So there are multiple different sources of the change, maybe internal, external, combination of both. And what happens is in emergence, there's a new pattern or direction that coalesces in the whole as a result of these forces. This is more unpredictable than adaptation, because in adaptation, you can observe the environment and make changes that make sense. In emergence, it might feel really spontaneous. And some examples I've seen in MDTs are the creation of an entirely new program that I'd mentioned. I helped evaluate the service advocate in LA, and I believe that that was an example of an emergent practice, which now we see these person-centered advocates in many places over the country, in MDTs and outside of them. I've also seen a task force emerge out of an MDT to address a specific problem. Another example is a member who provides access to their internal data, which can help drive the team's strategy in their cases and overall in their operations. Another characteristic is that complex systems are nested within multiple other systems. For example, each MDT is nested within a set of social, legal, and medical organizations. And these organizations are nested within a region, a city, or a county. And then there's a state. You also have systems of cultural groups, commerce systems, and so on. And in these nested systems, they each affect one another. So the smaller systems affect the ones that they're within, and the ones that are the larger systems affect the systems that are inside of them. And they may not be exactly concentric, like in this graphic. It might be more like a squishy Venn diagram. And also, it's often hard to tell the boundaries between the different systems. It's not always clear. Like, for example, on an MDT, each member is part of their organizational system. When they're in the MDT, there might be there is a different set of operations and protocols. So there's a convergence of the two. So they're both doing the work of their professional system and the work of the MDT. Ripple effect mapping, I want to mention, is a strategy of developmental evaluation strategy that I'll be talking about sooner or later in the presentation that helps you to identify and graph out the different impacts you're having in your surrounding systems. And then finally, the characteristic of nodality is essentially a node is a point of intersection of multiple different pathways. It's a connection point. This concept is used in Everett Rogers' Diffusion of Innovations. It's a really great book, but maybe kind of a dense read. And he found that certain types of people who were socially well connected and respected were able to spread new innovative ideas more quickly and successfully compared to other people who were less connected. So MDTs are nodal in that they are a convergence point for the organizations and fields of the individual members who regularly attend. And not only do they exist within these nested systems, but they're a point where information can diffuse quickly to many areas at once. One of the first national surveys of MDTs I helped with found that members felt that they became better at their jobs as a result of participating on the MDT. So to me, this shows skill and knowledge increase, which is then diffused to their outside work and perhaps shared with colleagues. So that's an example of nodality. And there are other levels of this too that I've seen, talking about the statewide networks of teams. and the hub model that the New York State has come up with. Those are examples of nodes as well, where MDTs can communicate with one another when MDT can spread information. With the node model, you have one coordinator who's facilitating multiple teams, so that person's knowledge and their skills can be transferred easily from team to team. And also consider those teams who are in connection with statewide and tribal elder justice coalitions. They're sharing information about what works and what's needed at the case level. In Wisconsin, actually, there's a statewide network of FASTs that periodically meets and shares what they're finding with the state level coalition. And so they're able to glean what gaps and patterns might be solvable from a statewide advocacy level. And the California Elder Justice Coalition also has that model where they meet with MDT coordinators throughout the state to learn about what's going on the ground floor with cases on the case level. I'm sorry, with teams on the situation level. And then feeding that information back up to the state advocacy level. So I just want to pause here so we can look at all of these characteristics as a group. And I want to say a lot of these are it's not worth, I mean, it's not just complex systems, but these are characteristics of living systems, which I think is really interesting. If you think about adaptation, emergence, nestedness, nodality, actually all of these are characteristics of complex living systems. In 2003, Pam Teester, Lisa Narenberg, and Kim Stansbury identified 40 MDTs in the United States. And 15 years later, I was in Kate Wilbur's research lab at USC, and our first national survey to MDTs identified 324 teams. And it may have been a cut above the teams, the types of teams that Chris mentioned yesterday, which is the brief conversation in the hall. We actually checked to make sure they were reviewing cases. There was a criteria that we had set for those we considered MDT. So from 40 to 324, 15 years. And in later surveys, we asked about funding, and our approximation was that more than 70% had no funding, and half of the teams with funding had less than $500 a month. So this explosion of teams didn't happen because of funding. Don't get me wrong, I want to say I think it's crucially important that teams have funding. We did find that the teams that were well funded, and you can see, I think, anecdotally in conversations you have with teams, say in New York or in Seattle, that are in California and LA, that are really well resourced, they're able to do some pretty amazing things and are leaders and models in our field. But just thinking about how these teams have exploded across the country shows to me, I think that life wants to proliferate. And I think it's worth considering and thinking about how valuable these teams are and what the unmet potential is. Okay, so let's come back down to the ground. I'm going to start talking about evaluation strategies now, and I'll tie in the implications of MDTs as complex systems into these. Something I want to clarify is that the word evaluation in the context of program evaluation research, it's not like an evaluation in school where there's a rubric, a preset expectations, and a grade that you get at the end. I think it's really useful to think of program evaluation like any other form of research. It's knowledge acquisition. We're posing questions, observing, learning, and making decisions based on what we're learning. So ideally, the learning should be neutral. You may find there are unintended consequences, or maybe the program's not doing the things you had hoped, but that's valuable knowledge because then you have choices. You can learn why and how those things occurred, and you can examine what positive things did happen and learn how to replicate those in the work that you're doing. So there are two paradigms of program evaluation strategies that I'll be going over. And a paradigm is a way of doing things based on a set of beliefs and ideas. Often the beliefs and idea are generally accepted and aren't up for discussion. And I think we human beings, we tend to go along with the predominant paradigm because it's what we're taught. It makes sense. Everybody's doing it, and there aren't any apparent problems with it. But new paradigms emerge when it becomes clear to some that the dominant paradigm isn't quite aligning with the world as new information becomes clear. And if anybody likes reading about that kind of stuff, Thomas Kuhn has a really good book on it's called The Evolution of Scientific Knowledge or something like that. But yeah, send me an email if you like talking about this stuff. I don't have that many friends that like talking about this kind of stuff. So traditional evaluation is the one that we're used to thinking about. This is the paradigm you're all probably familiar with based on one set of assumptions. Developmental evaluation is a newer approach, and it's based on another set. It's the road less traveled at this point. So first, let's talk about traditional program evaluation. And just a heads up, I'm not going to walk you through how to do an evaluation. There's lots of great guides online. The Technical Assistance Center with the DOJ has one. The CDC has ones, and all that stuff is available to you for free if you want the nuts and bolts how-to of how to do an evaluation. This is just conceptually looking at what is program evaluation, and it's essentially fits into these four processes. You have questions that you ask, information that you gather to answer those questions. There's analyses that you do, and then decisions you can make based on what you find in your analyses. That's the scientific process. Remember that from third grade. Now, evaluations can range from simple and easy to complex and resource heavy. And a lot of you have done evaluations. If you've ever had to complete a report summarizing a program for a funder, you've done an evaluation. So these components are true for both traditional and developmental evaluation. And I think for both, you want to look at why you evaluate an MDT. And there are lots of reasons why. It's to make the team or to make the program better, to learn about it, to learn how it works, to, if you find good effects, to spread those out to other places. Evaluation can inform your strategy, and it can lead to more evaluation. One evaluation can unearth some questions, really important questions. It can show you how to answer questions further on down the line. So here now we're thinking about traditional evaluation. There's a few different types, two different types I'm going to tell you about. And one is a process evaluation, which is learning about what the program does and how it does it. This is also called formative evaluation, and it's a crucial first step before moving into evaluating whether the program is doing what it was designed to do. Process evaluations, they're sometimes overlooked because, we have these assumptions. We made a plan, we put some money into it, we brought in the people, we're doing the things, and it's all working the way we have it laid out on paper. And, sometimes that's not necessarily true. Sometimes things hit the ground and people adapt in the real world. And so process evaluation can help answer questions about maybe details that weren't included in the plan, or how the actual operations might have adapted in the field. And the reason why this is important is because when you start evaluating whether or not the program actually works, whether it has the effects that you intended, you want to know exactly how it works so you know what you're evaluating. And this is an outcome evaluation. So with an outcome evaluation, like I said, you're looking at who the program is affecting and in what ways, and it's bigger than just the maybe anecdotal answers to these questions through stories. It's a real focus on quantifying, using categories and numbers to understand how people are affected by your work. And this can include short and long-term outcomes, like you might want to see how situations have changed at case closure, maybe 3 months after, a year after, as well as bigger impacts, which could go beyond the individuals you're serving and into other stakeholders, the community, and longer term impacts like 5 or 10 years out. So I think in MDTs, it's really important to look at how members are changed as a result of being on an MDT. And I know it's not the reason we brought MDTs together necessarily. The focus has been on helping improve outcomes for older adults. But a lot of what I hear about when I talk to teams and coordinators is the changes that they go through in their ways of thinking and their ways of working together. And I think that has some really significant implications that I'll go into a little bit later. Okay, and then there's a few different ways, a few different types of data. The first is qualitative, which I mentioned before. It's stories, essentially. Qualitative data is stories, and it might come from interviews, case notes, or medical charts. And I remember once a research saying that stories aren't data, and man, I've been chewing on that comment for years actually, because I do disagree. As a qualitative researcher, I think stories are a really valuable source of information. And I think what that researcher meant was that you cannot use a story to tell whether or not your program is affecting people significantly, whether or not it's affecting the majority of people in a certain way. Stories are used as anecdotes to give you more contextual information. The strength of a story is, although it's not inferable to a larger group, is that it can highlight important nuances or missing pieces of the picture that are entirely overlooked by quantitative data. So I believe, and actually, qualitative data does support better outcome evaluations by identifying which crucial data points you should be collecting that you might not have thought of in the beginning. Then you can go on to tell whether the program is working in the way intended and for what proportion of clients and what to do and to what extent, excuse me. So again, that's that quantitative data, which is your numbers and your categories. And this is where you can know within a certain degree of error what's working for people and in what ways. Okay. There's a lot of really great stuff we've learned from traditional evaluation. There have been decades of published research on elder abuse MDTs through traditional evaluation to show the structure and activities. And we've learned about different types of teams, their benefits, and their challenges. So the bullets here, this is a super quick bullet of things that I feel are important for the purpose of this conversation, but there are great MDT literature reviews elsewhere. I think it sounds like they had done a good one for this summit, which is available to everybody. But overall, what I've seen and what the research tells us is that members have a really positive experiences with MDT in general. They feel that MDTs help older adults whose cases are reviewed. People also appreciate that they facilitate cross-agency collaboration outside of meetings, as well as training members on other member agencies' roles, capabilities, and limitations. And doing these things, getting a better understanding of everybody's roles and the time spent working together to help older adults improves communication and relationships. We've been talking a lot about that, creates a sense of camaraderie among members. And there's something about, like, that's the secret sauce, I think, in MDTs. There's something about the relationship and the camaraderie where teams are really able to think well together. They're able to think from outside their professional roles, even. I remember a DA at WDDA saying that, oh, she's learning how to think like a social worker, and how great that was for the work that she was doing in her team. I mean, in her organization. So when we've asked members to define success, people, you always go first, I think, to the older adult and what kind of benefits their work has had for the client. Um, such as connection to resources, improving their safety, improving their well-being. But I find a lot of the focus of these conversations when we ask them what is success in general, not just focusing on outcomes, is they talk about learning. For MDT members, learning is success. Um, And I think that's important, again, because I really see these MDTs as learning organizations from the observations I've had and the research that we've done. One piece of research that was really important was one that was a quasi-experimental study that found that MDTs are more likely to result in successful prosecution and guardianship. And that one was important because of the methodology. It used a control group. It was a similar group in what they called usual care within APS, and they compared what happened with both of them. And so I think it's so essential to point out, again, I think I already said this, but this has taken so much work, all the stuff that we've learned from MDTs. And it really feels like if you think about it from the point of view of somebody who sits in these team meetings and who has participated and has gone out in case calls and has watched how your work has affected your clients and the community, this just feels like it's barely scratching the surface of the real meaningful outcomes and impacts of MDTs. I've heard stories of teams and actually observed team discussions where the team had to come together quickly and saved an older adult's life, where creative solutions emerge. People are able to, I don't want to say bend the rules, but maybe expedite services so that they're able to more quickly respond to a life-threatening situation. Okay, back to what are the assumptions now? When we're doing traditional evaluation, where you have a defined set of outcome measures, when you've got data that you're planning to collect and you collect it, you have a sense of where you're going to go with this evaluation, a plan, and now you're following the plan. Here are some of the assumptions that process makes is that first, the program is stable, it's predictable, and it's self-contained, that there's likely not other outside forces that are affecting the outcomes and results that you're measuring. Another assumption is that the problem you're solving is well understood, that you have a very firm set of logic of how to solve this. Also, that there's a predictable cause and effect, and that there are clear and measurable indicators of success. Now, although many of us have written grant proposals and designed logic models that on paper show clarity in these areas, there are a couple major issues in these assumptions. First, as I discussed in the beginning of the presentation, MDTs are complex. They change slowly or sometimes abruptly over time, and the work that they do is not contained, but it spans across multiple agencies. Sometimes there are agencies that aren't even on the team that might be helping out or interacting with the older adult. It's really difficult to determine through generalized quantitative data whether an outcome occurred as an effect of the MDT or through some other outside source or a combination of the two. And the casework in MDTs, my goodness, from the many, many case discussions I've sat in and observed, these are among the most complex, where abuse may be co-occurring with multiple other issues such as self-neglect, substance abuse, housing insecurity, mental illness. Sometimes there's no clear delineation between the perpetrator and the victim. And when you've got those types of situations, it's really difficult. You don't necessarily have a predictable cause and effect. Yes, there's elder abuse in there, but what to do and how to solve it, especially when you're bringing in persons, very important and crucial person-centered approaches and trauma-informed lenses, it's can be murky. So I think the real crux is this question of how do you measure success? And although it may seem like measuring success, it should be pretty clear cut, right? These teams come together to address elder abuse. So success should look like a reduction of elder abuse, a reduction of or improvement of safety, reduction of risk. But I think it's a lot more complex. And I just want to tell you briefly about one story. This story is actually very similar to Claire, who was discussed in the person-centered panel yesterday, and it was published in a paper that I wrote called Conceptualizing Person-Centered Care and Elder Abuse Interventions. It's open access and free. If you just Google it, you'll be able to find it and read the details of the story. But essentially, Mrs. M was brought to the team meeting because there were several suspected incidents of financial exploitation. There was a risk of neglect. And she had a young man who was living with her who she had saved from homelessness, but he was also, openly engaging in substance abuse, and her care was really neglected. She had sores and other issues. There was issues with cleanliness and falls in her home, but she had this young man Tom there to help her, and she was assigned to the service advocate of the team. And her role was to learn about the client's wishes and advocate on their behalf. So Mrs. M's, her highest priority, she wanted to be at home. That was her top priority. No matter what, she wanted to stay in her home, and she really wanted the service providers to just leave her alone and stop knocking on her door. She did accept help from the service advocate because the service advocate led with, "Hey, I just want to learn what's important to you and help you get that." And she said, "Okay." And so what ended up happening through this case is that the service advocate worked with Tom, and she helped him to become a better caregiver. She enrolled him in respite. She taught him how to reach out for help. And in the end, Mrs. M was able to remain at home and died under hospice care, and Tom was at her side. Now, from the team's perspective, at first, this case, it was so complex. It was like 40 pages of single space case notes that I read. There was so much that happened here that I'm not able to share. It didn't feel like a success for the team. It felt like a barely managed disaster, actually. But when we brought a person-centered lens to this case, we were able to realize that um, stepping outside the frame of the team's problem solving and the usual tools that are used, that this case actually was a success from Mrs. M's standpoint. And um, we found this framework called the 5 domains of well-being, which helped us to see this success. It helped us to kind of delineate these different areas of well-being: stability, mastery, connectedness, safety, and meaningful access to resources. I'm going to go over these in more detail in my workshop if you'd like to learn about these and how to use the 5 domains of well-being in your case discussions, and to use them as you think about how to measure success. But essentially, if you look at what Tom was providing and what her home was providing, she had her most important needs met, and that was stability. Things are the same from day to day. She had a sense of mastery and was making choice in her life. She was connected to Tom, and she was helping him too. She felt really good about being able to help them, and they actually did have a they had a lovely relationship. And also for Mrs. M's safety, she wasn't worried about safety from elder abuse. She was worried about safety from being removed from her home. She was worried about safety from the service providers who were coming to her door, and the doctor who was telling her that she needed to be in skilled nursing. So what she was lacking was meaningful access to resources, which the service advocate was able to help her get some of the health care that she needed, and also to improve her caregiving. So I think it's worth noting that when we focus solely on elder abuse risk and severity, there's a lot outside that tunnel view that is missed. There's a lot of other moving parts that may be crucially important to the older person. So it's possible that a successful reduction in risk and severity of elder abuse could also be, from the older adult's perspective, ruining their life by putting them in situations they didn't want. And this image shows some of the essential aspects of a case of abuse that a sole focus on safety and risk miss. Now, I think, again, trauma-informed and person-centered conversations and pulling back our frame on what we're focusing on, looking at the bigger picture, changing our perspective, can help us look at these things a little more closely. even to put them on our radar as we consider how to move forward with our case. I'm sorry. I'm not sure if we're not supposed to be using the word case anymore, but I'm going to use it from time to time. By case, I mean situation. A case is not a person. I agree completely with Dr. Mosqueda. Now, I want to point out that from the perspective of program evaluation, so let me take a step back. This is textbook social work, looking at all of these things. And I've had a lot of people say that about my research, like, we learned that in social work school. From a research standpoint, this is a really difficult set of measures of data that you would need to collect and analyze in order to get the comprehensive outcomes that are important in elder abuse interventions. This just hasn't been done. And another issue with that is that these things change over time. It's a real challenge with measuring success. Is that just for example, if you're depressed, anxious, overwhelmed, if you're ashamed, what you want in the moment when somebody's asking you, well, what do you want? What's important to you? What's success from your eyes? What you say in that moment might change as you get support or as you begin working through the process. So that's another thing, is that what people want, what's important, success changes. It's not necessarily a spot that we can hit. It moves over time. So this is my opinion. I'm not saying I don't think it's important to collect outcome data. I think it is really, really important. I think it's just essential to acknowledge the limitations that some quantitative data can have in understanding our programs, how well they're working. And if you have experience collecting data and you have other opinions, I would love to hear it. Show up at my workshop, or come, I'll be at NAPSA at the end of the year. Come find me, and I would love to hear other sides of this and talk more. Okay, so now let's talk about developmental evaluation. I believe this can help us circle in on looking at more individualized, nuanced successes and bring MDTs to levels of evaluative thinking and responding that traditional evaluation may not have the capability of doing. So I learned about developmental program evaluation through discussion about the puzzle of program evaluations where these programs are solving really complex problems. So I've done a lot of reading in other fields, and as I mentioned, a lot of this has come from other fields. And developmental evaluation is just one term that is used for this form of research. It was brought around by Michael Quinn Patton. And essentially what it is it's a process. Developmental evaluation is a process for accompanying innovation and adaptation with evaluative thinking. So you're doing the program while you're thinking evaluatively. In real time, you're collecting data. Maybe it's stories, maybe it's numerical data. And it's applicable, most useful to programs that are addressing wicked problems where the exact solution and outcomes are uncertain. But there is a vision for improvement. Have a general sense of the direction that you want to go into, and also you understand that learning and clarity will emerge in the course of the work. So here's a comparison of traditional evaluation to developmental evaluation. The purpose in traditional evaluation is accountability, where in developmental evaluation, it's more about learning and adaptation. The evaluator is external in traditional evaluation, whereas in developmental, they're embedded in the team. Overall, developmental evaluation, it's a more flexible process. I think it's a hard one if you're like wanting to write a research grant or wanting to design a predetermined research program. That's not developmental evaluation. Developmental evaluation is about embedding these evaluative practices and its ways of thinking that happen within the team. And I think actually a lot of you are doing that already, just based on the discussions and the presentations I've heard. The approaches look like participating members to solve a problem, and they're asking questions and learning as they're solving the problem. It does include mixed methods data collection. And Patton's text has a lot of great examples, but this is new, and I think there is people are learning. I think professionals in the field are learning about what this looks like as they go. So I'm going to summarize some of the strategies that are described out there for developmental evaluation. And the first is just to think evaluatively. And I think a lot of the presentations we've already been discussing that. These are things you're already doing in your case discussion. And it's asking things like considering stepping back, looking at what is success for this person? How do we know that? What is success from various professional standpoints? And looking at all of those things before you maybe jump into problem solving. And of course, to do this, it's really important to encourage a culture of safety and learning. Like there are no wrong answers or no wrong questions. There are no wrong opinions. You might want to look at what your assumptions are about the person and their situation and step back from those. Look at what you don't know in the situation and how you can find out, and consider what the unintended consequences might be. Paige had mentioned that in her presentation yesterday, and also Renee did about unintended consequences of, say, a prosecution, and thinking that through and thinking about how you could use that as a tool without imposing those consequences. And also looking bigger picture, look at what patterns you see in your casework. If you see cases that are similar, what does that tell you about your community? What does it tell you about your clients? These are things that I've seen teams do in retreats, or you could embed them into your case discussions, or you can have separate time to just take a step back and consider certain things as a group. Strategy 2 is applying evaluation logic. So where logic modeling in traditional evaluation, I think it's really used as kind of a one and done. Maybe you update it every once in a while when you're applying for funding or when your project is over. But in developmental evaluation, this is a living, breathing document. You can go online and learn about what logic modeling is, but it's basically depicting what is happening in your program. What are your resources? What is it you're doing? What are the effects that you're having? And as your program changes, you'd want to update, revise that logic model. Ripple effect mapping, I'll be talking about in the workshop. I'll be able to touch on that briefly now just to tell you what it is. And like I mentioned, I'll be at NAP, so I'm actually going to give a workshop on ripple effect mapping that will be interactive. So if you're going to be at that conference, you can do that or reach out to me. I'm happy to share resources. Data, gather data. Remember, stories are data. They're important. You can look at stories and learn about patterns. You can look about what success might mean for certain people. And then use what's learned. Take what you've learned from the data, from the stories, from the discussions that your team is having, and see if there's any changes that you might make in your program. Strong relationships. It's the secret sauce, man. This is all the coordinators I've spoken to know this and are good at this about fostering those strong relationships within the team, but also think about who's outside the team that might be impacted by your work. Create lines of communications across those different stakeholder groups to share findings, feedback, collaboration. I think this is also a great way to brag about your MDT. One thing I think we don't do a good enough job of doing is sharing with folks outside the MDT world the amazing impacts that you are all having in your communities, the ways you're helping older adults, the way you're bringing organizations together, and the magic you're able to work through your in the field collaboration. I think is worth sharing. And then the fourth strategy is to use database reflection and decision making. And that's, again, I think I already mentioned this, but just to make sure you include time for reflection, put it on the agenda, review what you're learning, ask people if they're noticing patterns and what they're thinking about that and what the implications might be. Okay, really quickly, I want to share with you this ripple effect mapping strategy. Essentially, what it is it's a way where traditional evaluation, you look forward. You say there's things we want to learn about, so we're going to plan to collect the data. Ripple effect mapping allows you to look backward and go, okay, well, what happened? What were these results, and what were some of the unexpected things that happened as a result of the MDT and the work that we did? And then also it helps you think about when you find out what the team has done, you can figure out how those findings can be strategically utilized back within your team. So essentially, it's creating it's learning about causal chains. What are the chain of effects that cause certain impacts? Um, from any impact, I'm sorry, I just rushed through that. From any impact, there might be woo, okay. Maybe I should just read my notes. Okay, the end result is a graphic showing what impacts occurred from your MDT, how they occurred, and then they're broken into causal chains. I already said that. So essentially, what ripple effect mapping is you get your group together. Maybe it's one-on-one interviews, or you get your team together and you ask them what things have happened as a result of being on this team. What have you noticed that has occurred for you professionally, within your organization, within your community? What good things have happened? Might have multiple different impacts. You might have impacts that you observe that are actually convergences of other programs and initiatives in the community. And it's important to notice, I think, how those things all work together. Here's the general procedure. I'll be going into more detail on this in the workshop. The first is you can do interviews, a group interview or one-on-one interviews. You create a map based on that interview, and then you can have a meeting within your stakeholders and make sure you're validating, is everybody seeing this the same way? Clarify those causal strings, and then pull out the stories. The neat thing about ripple effect mapping is it does give you a graphic that you can share with people. I think it creates a good pitch for the great things that your team is doing, or you could use to get more in-kind support, and maybe get some funding to show, like, look at the impact we're having. Imagine what we could be doing if we had more. There's a lot of flexibility in this process, and I just want to acknowledge some people might be thinking like, I'm already so busy and we don't have enough funding to do all the things that I think we should be doing, and now you want me to be launching these research initiatives. I think ripple effect mapping can be a state of mind. If you are thinking for these ripples, if you're thinking about them and learning how to recognize these systemic results, I think that's enough to start capturing stories that can be useful for your team, and also for sharing the value of the work that you're doing. Okay, and I might have already touched on some of this, but ripple effect mapping is good for young teams. The process actually helps to deepen relationships and mutual understanding among stakeholders. So this is something you could do, like maybe it's a team retreat where there's no case discussions per se, but maybe you're just stepping back to look at your work. This can help generate conversations, and help create mutual understanding, as well as a feeling of positivity around the work that you're doing. It helps to create that visual, and then also to learn about untapped resources. Maybe there's a chains of communication that you learn about through the ripple effect mapping, or certain resources or ways of looking at things that are important to consider in your strategy moving forward. And for more established MDTs, it can help you understand what accomplishments and impacts that you've had that have taken many years to coalesce. And again, I think it really helps to capture things that are unexpected. If there's things that occur that you never would have thought would have happened out of your MDT, learning about those can help focus your efforts as you move forward. And again, these can all be compelling stories to help share with others and to institutionalize your MDTs work. Okay, so I mentioned a few times I'm going to be doing a breakout workshop number 3. I'm going to give more details on ripple effect mapping, what it is. That information is available elsewhere. There's lots of other great concurrent workshops. Something else I thought would be worth discussing in the workshop is outcomes, absolutely. And I haven't actually done this, but I'd be really interested in talking with folks on teams about how the full frame initiatives, 5 domains of well-being, could be used to frame case discussions and help create a different perspective on what it is the older adult wants. I also want to say in closing that I, like the astronaut at the beginning on one of the first slides, I think I am somewhat orbiting in the sense that I do not do field visits. I do not work one-on-one with older adults. I'm a researcher. I've observed an awful lot of team meetings. So I'm more of a person who's been able to look at patterns and think about them and read a lot about what's going on in other fields and think about the applications. What I'm really interested in is to hear and talk with people in the field to see if this lands well with you, if this makes sense, or if there's any of these strategies that you're already using and work really well, if you have examples to share. So if you have anything like that you'd like to bring to the discussion session, the workshop, I'd love to hear about it. One thing I'd like to mention, I think there's a couple minutes left, is a developmental evaluation, I believe, and I actually do see it happening in teams, other teams in other places. It really is a way of thinking and using the information that you are just gathering anyway through your case discussions and your solution making. And I just want to share one example of a team in Colorado that noticed that a lot of older adults did not want to move into a nursing home, a facility, even though it was the best solution and there was a good facility that was found. They didn't want to move there, even though it would have been safer and better for them because they couldn't take their pets. And that was the sole reason. Otherwise, it would have been a fine solution. But because they couldn't take their pets, they didn't want to. And so what this team did is they went and they talked to facilities in the area and they got them to adjust their policies. And I just wanted to share that. This is an example of taking data, pulling it, and learning about patterns and then running it up the slide to a more systemic solution. And I think that's being done in teams all over the country. And I also think we could systematize that a little more, recognize that you are doing evaluation, recognize the power of it and follow it through. And with that, I think we have a minute left. I don't know if there's any questions, but Shelley, I'm going to defer
Julia,
to you.
I don't think you even have a minute left, but thank you, Julia.
Thank you so much.
That was terrific. And you gave us so much to think about. I really appreciate it. We think program evaluation is really important, and this is a kind of a new way to think about it. I'm unfamiliar with it, so I'm going to learn more about it. And we really appreciate you sharing it, and hopefully some people will be seeing you this afternoon. So thanks, Julia. We're going to take a 5-minute break now.